Good evening, guys. Today I'll be giving you 11 tips on how to take care of your parents, your grandparents, whoever it may be, and help them in any way possible so that they do not fall. Because above the age of 65, 70, if they do fall and they fall from a standing height, usually they tend to have femoral neck, intertrochanteric, or other fractures of the femur, which are fractures are detrimental to elderly individuals. So I'll be going over a few ways on how we can prevent them. For example, in a study done where they surveyed 788 elderly patients, by elderly, most of them were above the age of 70 years. The average mean age of this study group was 75 years. And with a hip fracture, they found that the 1 month mortality was about 5.7%, and 1 year mortality was about 20.2%. So there's a 20% chance you can die post 1 year after a hip fracture if you're an elderly patient. So why not avoid that whole situation itself? Because even though we have come a long way in terms of how to treat it, it's better to avoid the situation at all costs. I'll provide a link to this article down in the show notes. Coming to the first point. So first thing is, never let your grandmother or grandfather or parents stand on a chair or stool to pick up something, even if the chair or stool is low, because if they fall from that height, the chances of a hip fracture are too high. Second, and probably one of the most critical tips is so if you are in the casualty of any major hospital, number one thing which someone will tell you in a history of how their parent or grandparent fell is they slipped in the washroom. Water on the floor is one dangerous thing. So by installing there's always water in the washroom. So the only way to avoid or prevent them from slipping in the washroom is to install anti-slip tiles. So this is how the anti-slip tiles look. So even if there's plenty of water on the floor, these tiles do not slip, and hence the chances of them falling drastically reduces. And instruct your elderly people to whenever they're wearing pants or their undergarments, they should be seated at all times. Because when you're wearing your undergarments or pants, sometimes your foot gets stuck. In us younger people, it's fine because we can regain our balance. In the elderly, where their balance is poor, if their foot gets stuck while putting on their pants or whatever, they can fall because their balance isn't that great. Next, handlebar should be installed in the washroom next to the toilet, and maybe even in the shower in certain situations, so that they have support while getting off the washroom, because while getting off the toilet they can fall down, because there could be water on the floor, or they could lose balance and a host of other things. So like the handlebars installed here, it's better to install them. So another important thing is, a lot of elderly people, when they come to the casualty, they come at odd hours like 4:30, 5. Now why is that? They would have gotten up in the middle of the night to pee, and so what they do is, they immediately, when they get off the bed, they sit up and they get up immediately. And elderly people, the regulation of blood pressure isn't that great. So what happens is, when they suddenly get up, they become hypotensive, get giddy, and fall down. So what they should do, they sit on the edge of the bed for about 3 to 4 minutes, and once they feel totally comfortable, then only should they proceed to get up and move towards the washroom. Another important thing is, if possible, they should have the switch for any lights right next to the bed, because again, in elderly people, their vision is compromised and they cannot see properly in the dark. So however familiar the environment is where they stay, it's better to have light when they walk around. So if the light switch can be near the bed, that would be a very great thing also. And also instruct them to not lock the toilet door when they go to the washroom. And in case of any emergency, like if possible, like an emergency bell or something in the washroom or in the room, in case they go through some medical emergency and can't shout for help. And another really important thing is which helps elderly with their sleep. Elderly people have bad sleep, they have difficulty falling asleep, staying asleep. For that reason, and also for the reason of vitamin D synthesis, it's a good idea that they expose themselves to sunlight in the morning and in the afternoon and in the evening. So the morning sunlight sets their circadian rhythm so that they wake up at the same time, and the evening sunlight exposure also regulates their circadian rhythm. And also dimming of lights in the night so that they slowly fall asleep and they can wake up early in the morning without having to struggle to fall asleep the entire night. And also bone density, with vitamin D synthesis, bone density is also better. So in case they do have balance issues, what happens is, even with my grandfather, what he used to do is he used to never use a walking stick, because it's be like, I'm not old, I don't need a walking stick. Better to drop the ego and use a walking stick or a walker to aid in balance, especially if you have balance issues. Getting your vision and hearing checked regularly, very important, as I explained why before. And improving body strength and balance. I'll come to what exercises you can do to improve that. And also talk to a healthcare professional regarding drugs. So you don't necessarily need something called a DEXA scan, dual X-ray absorptiometry, complicated terms. So what that basically does is it calculates your bone mineral density. You don't need to do a DEXA scan. It's used to confirm osteoporosis, but even on a regular, let's say a spine X-ray or like an X-ray of pelvis with both hips, you can see and tell if a person is osteoporotic. Especially postmenopausal women above age of 65-70, their bones are extremely osteoporotic. And you can always talk to a healthcare professional regarding certain drugs to enhance the bone density. So avoidance is better than cure. So if your bone density is better and you do end up falling, the fracture might not be as bad, or there's a chance you might not fracture anything as well. But if your bones are very weak and you do end up falling, you are definitely going to end up with a fracture, which is what we should try to avoid. So coming to some of the exercises. So what they can do is something called marching in place. They just hold the back of a chair and make sure it's a sturdy, heavy chair, because they put weight on it. It's a plastic chair, it'll just topple over. And they should do marching. So that's pretty self-explanatory. Then comes something called a single leg stance, where they stand on the chair holding it, and then they lift one leg backwards, hold for 5 seconds, then the other leg backwards, hold for 5 seconds. Next thing is walking heel to toe. Heel touches the ground, they slowly walk, go to the toe, and they alternate walking. They alternate each foot while walking. Come to the next thing, foot taps. Place a small low stool in front of you, and each foot should go and tap the footstool. And what this does is it improves balance and coordination. Something called rock the boat. Keep your feet hip width apart and slowly transfer your weight from the right leg to the left leg and lift the other leg when you're transferring weight. Toe raises. Hold the stool and you go stand up on your toes, hold for 5 seconds and come down. All this is very good and improves your balance and your stability while walking. And also reflex training is important in the elderly. So coming to some of the strengthening exercises, very simple, can be done at home while sitting. You sit on a chair like this lady, lift one leg out in front of you, hold for 5 seconds and pull it down. So with all these exercises, especially with this strengthening one, if the exercise becomes too easy, you can put ankle weights and make it a bit harder. So warm up is stationary march past with the arms swinging. Then sit to stand. Basically, this is a squatting. Sitting to standing is one of the most compromised positions in the elderly. So doing sitting and standing regularly a few times a day is a very good exercise. Standing hip extension, where you stand and suppose this is your leg, you extend your leg backwards. And of course, if this is your body, you lift your leg sideways, backways, forward. Everything should be done. So yeah, these are some of the ways how we can prevent falls in elderly and also increase the strength of their lower body, so that if they do fall also, if the muscle mass is more, the muscle is most likely going to protect the bone from breaking rather than in a frail individual. All right. Thank you guys. Have a nice day.